Guys.
Yeah. All right. But I will say, there's a lot of mixed information coming from all sides. For example, this CNN article is saying experts say more advice is needed. Evidence, more advice. I love it. More evidence is needed. On the other hand, I just also feel like this would be a huge blow for ibuprofen. So maybe experts really just mean people from ibuprofen saying more evidence is needed. I don't know. I'm just saying. Okay, allegedly. Okay. Anyway, I watched Dr. Campbell on YouTube. Great guy. Mm-hmm. I sound like Donald Trump. Anyway, he said that it is quite possible that he wouldn't be surprised because anti-inflammatory drugs, right? If you're trying to lower your fever, for example, that's not great because the fever is what helps, is what prevents the virus from, to a certain degree.
The immune system,
right?
Acting,
right?
Doing stuff.
Exactly. So if you really have a headache, maybe don't reach for your ibuprofen. Maybe reach for paracetamol, something that's not anti-inflammatory, right? So that was a fun fact in the safety guide. Next, what can you do to like really, really prepare? Well, you can get an oximeter. Basically, what this does is it's a tiny device you put on your finger, and I have it at home.
I cannot believe you have an ox.
What? I am a hardcore prepper is me. Oh. Okay, and you put it on your finger, but it's really actually useful in the sense that it measures your oxygen saturation. And if there's anyone at your house that you're concerned about is at risk and could get the severe case of the virus. Now remember, the severe case is around 20% of people will have symptoms like that are not
10 to 20.
Just mild. Yeah. So this measures oxygen saturation, and if it drops below 90%, then that's a warning sign. It means that you might have to go to the hospital. So that's a great way to measure if somebody needs to be hospitalized or not, especially as hospitals are going to be full.
Of course, by the time that is not the only warning sign.
Probably.
If you get a fever,
definitely.
if you get a dry cough, even a wet cough with mucus, if you get muscle ache, muscle pain, just search up the symptoms. If you do get these symptoms and you feel like well, I can't really say if you've been in contact with someone because community spread now, but really call your health provider, first of all. Don't just waltz into the emergency room coughing all over people. Tell them that you've been feeling ill. Most probably an ambulance will come pick you up and you'll get tested and, well, good luck.
Good luck. We love it. That's it. Goodbye. No.
Goodbye.
I'm kidding. Alright, oximeters. Yeah, I mean, it's not the only warning sign. Like, you don't need to depend on it, but it is a really good one. And I heard a doctor say that, if you measure your oxygen saturation, that's when you know, like, you need to be hospitalized. Alright, next thing is, and this just keeps getting progressively more hardcore, but ventilators. You guys, in hospitals, there's not enough for the whole country, especially if 70-80% of the population gets sick.
Are you telling me to buy a ventilator?
No, not you, but listen. If there so stop.
Can people even can people even operate those? Like
yeah, you can if you're smart. I don't know. Okay, listen. If I see you Googling.
I am Googling this. What? You want me to operate a ventilator? It looks complicated. I'm not going to be figuring this out. You think a grandma in her 80s laying down with her
No. Listen, okay. If there's somebody really at risk, like if you live literally with your grandparents, I'm just saying the whole thing, the whole situation with the virus is probably going to keep getting progressively worse until some point where it peaks. And then it might start getting better, like in China now. It's getting a little bit better. But there probably won't be enough ventilators in hospitals. So if you're extra concerned, maybe it's time to start looking into ways that you can build your own ventilator. Now, this is really... Build. Cisco, stop cringing. Okay, that you're really ruining my show right now. No, okay.
Sorry. But... All right.
No, listen here. Yeah. This is my nerd moment. I need my nerd moment.
Okay. Commence.
Now, if you... Obviously, this is really going out on a limb here. DIY ventilators aren't even really a thing. But they're technically possible. And if you're really technologically savvy, just Google DIY ventilator, okay? I'm just saying.
We are not responsible for any injuries. Oh boy. Well, very nice. Okay, what's next?
Very nice. Okay. Next, we have the second coronavirus. Fun fact, I will totally admit, I forgot about these for like half the segment. I mean, half the whole thing. So now we have to smash them in. Alright, second fun fact. Tell me now, do you think the Corona beer company is making money from the coronavirus, or do you think it's losing money? Which you kind of spoiled for us already.
I apologize.
No, what do you think?
Corona beer, I think, what people are seeing, they're seeing the beer, right? They're like, I don't know, you know what? I don't know what to say to this. I want to say something funny, but I ruined it, and I just feel ashamed. Is the Corona company, wait, no, not Corona company, is the Corona beer company losing or making money?
Alright, here's the deal. Because our sources aren't from Facebook, but they are from other more reliable sites. See, this is what you call self-promo, okay?
Mm-hmm, mm-hmm.
The truth is, Corona beer sales are actually going up.
Oh.
Now, see this, here's the thing.
Mm-hmm.
Before that, there was a viral post saying they're like way down. People aren't buying the beer. But apparently, Constellation Brands, Corona's producer, says its US sales are up in the early part of the year, and since it doesn't have much exposure to international markets like China, which suffered more, the Corona Extra sales grew 5% in the US in the latest 4-week period. Pretty cool, right? This is a fun fact, but now I'm just reading statistics. Okay, let's quickly move away from this.
That's real fun. I had no idea. Well, good for them. Good for them.
Good for them. Now, we are nearly reaching the 40-minute mark, but I know there was something that you actually wanted to talk about and educate our viewers about the impact of protective measures.
So, you might have already heard of this. The two types of curves. The curve that might or is already, being modeled. What's happened in Italy, what's currently happening in Italy, what's currently happening in Iran, and what happened in China. A curve that happens when no measures are taken, no proactive measures are taken, and even reactive measures. There is a certain point, a certain line on the x-axis, which is the healthcare system capacity. This capacity means how many infected people the healthcare system can support, can provide for. As you've already heard, 10 to 20% of the cases will become critical or at least serious, which means that the individual will need to be hospitalized. 5% of those cases will become very critical, meaning that they will have to be on ventilators, they will have to be getting very serious, they have to get a lot of intensive care. When you do not take proactive measures, any protective measures when the government doesn't issue any, this will mean that the curve will be very steep. Cases will start to rise. There will be a climax, a peak. That peak will be much higher than the healthcare system capacity, which means that there will be a point where the healthcare system can no longer provide for the population. There will be 1 million people sick. 20% of that million, 200,000, will need to be hospitalized. Do you really think we have 200,000 hospital beds with ventilators? It's a serious thing, and if this does happen, if countries do not take these measures, then the healthcare system will be overwhelmed, and we will have to start making sacrifices. Honestly, very hard decisions, and it's going to be scary.
Absolutely, that is what is happening in Italy right now. They have to decide who they're going to treat and who they won't, because they just lack capacity.
Apparently, in northern Italy, in the area most affected, they only have about 15 more hospital beds with ventilators. Correct me if I'm wrong, of course. And it's a very scary time. The death rate it's just insane. you look at the amounts of deaths in Italy, it's scary. But then, of course, if the government does take protective measures, and they make sure that there's social distancing, schools are canceled, public events are canceled, people are wearing masks, people are not going out as much, we can level out the curve, which means that there will be cases over a longer period of time, but it will never reach above the point where the healthcare system will be too overwhelmed. And that means that throughout this, it will be a longer period of time, but at any point in time, the healthcare system will be able to support the people who need to be hospitalized because of the virus. And so those are the two curves. So any government official listening to this, I implore you, please...
Hello, Babish.
Hello, Babish. Please take... Well, he's already taken big measures, so please do that if you don't want your healthcare system to be, overwhelmed.
Absolutely. And actually, you just created a great segue for me. You didn't even need to do it, but thank you. Into talking about... And this is, you know what, I sound enthusiastic. I should really tone this down a little bit. This is not like coronavirus, yay. Okay, so I'm just in a good mood today, but this is pretty serious. But there's a absolutely fascinating article on Medium about how you can actually, first of all, the fact that there's a disparity between the amount of people that are officially infected, right? And the amount of people that are actually infected. Because if you think about it, the incubation period is 2 weeks long. So anywhere in between that, there are probably people who are sick. So technically we're seeing numbers from maybe 2 weeks ago, maybe like a week ago on average. It's like, the sun, you actually see the light from 8 minutes ago. But basically, what this means are that anywhere you're living right now, unless it's like 2022 and no coronavirus exists anymore, I don't know, anywhere you are, the number of cases is probably much higher. And how this ties in with the article is, it's absolutely fascinating, but they have, obviously it's an approximate calculator, but it calculates how many people could be infected in your area right now. Infected people in your area sounds like an ad on a really shady site, anyway. It can calculate that, and it'll give you like a range of numbers, right? It's not concrete, but it uses this based off of like China statistics, what they used to be, and just in general how many people, I don't know, just calculations, okay? I'm not gonna get into this right now, but it's super interesting, and I tried to use it. Actually, the Google Docs was down because too many people were using it at once. Wow. But it's really interesting. I would recommend, absolutely. All right, and I think that just about covers everything except for coronavirus memes. And these coronavirus memes probably...
Also, I want to quickly talk about scary times. Just quickly, statistics. As of yesterday, Italy broke the record. They had the most deaths in one day ever. They surpassed China. It might look like China's in the lead still, but right now the amounts of active cases, Italy has got that title. What's fascinating to me is that a month ago it was me writing to my Chinese friend asking, hey, are you okay? How is everything going? And today it was her writing me asking, hey, I heard Europe is not doing well. How are you? I'm like, yeah, same as you like a month ago, kind of similar, but...
To be fair, that was rather a macabre way to interrupt coronavirus meme time.
I apologize. That was a little sad. I understand that in situations like these, you just it could feel so overwhelming, and so you could feel very helpless in these situations, but keep your head up, I guess. All right, back to your coronavirus meme.
All right, without further ado, this is the way that we're going to end this podcast. We're going to put up on the screen right now coronavirus memes. I know this is kind of unusual for a podcast because if you're listening in and driving a car or something, sorry about that. Anyway, here are coronavirus memes that we found funny. We hope you'll enjoy them. And with that being said, stay healthy, stay safe, stay non-infectious, and see you next time. Stay informed. Absolutely.
All right. See you next time.